see if we can free up some of this here. I just want to see if we can dissect it a little bit and get some more of this, some more of the tissue away from the side of the bone.
Get such stuff in
Yeah,
here.
that'd be great. Thanks.
You almost down to the femur there?
Yeah, I'm down to the femur. I'm just trying to dissect a little bit
You
here.
got a little bit of blood here.
Yeah. I'm gonna grab that bone. Are you anywhere we can grab the bone wax? Well, I know we'll need it. I got it. I'll hold this for you. I'll wait to ream until you have it. Yeah, perfect.
That looks good.
Put it in your hand. Yeah, that's great.
There we go.
Can you hold this too? With
Yep.
the other hand?
Okay. You good here? How's it going?
Good. Just reaming here.
Excellent, excellent.
Yeah.
He was going?
Yeah.
I heard 80 miles an hour.
Easily.
That's not good. Resection again.
Yeah.
Speaking of fast, he's getting tachycardic now. What are you up to right now?
I'm almost done with the ream.
You know what, Liza, hold off there a second.
Oh, okay. What's
I'm
wrong?
having trouble with my CO2 dropping. I think his pressure's probably low.
Okay. Yeah.
Can you feel for a femoral pulse there, please?
Yeah.
I don't feel carotid. Do you feel any
I
femoral?
don't have anything here. Hold on.
All right, start CPR.
Okay.
Liza, I want you to start at 100 per minute.
Okay.
Fast and deep.
Okay.
Sandy.
Sandy, do you mind covering up the wound
cover
while I
up the
start?
wound here. After she's gone for a minute. Rich, call a code.
Yes, ma'am.
Need the table down.
I'm good.
All right, I think we're all the way down. IV fluids open. We're on 100% oxygen. Volatiles are off. That's how you doing?
I'm good for right now, but I'll probably need you in a few minutes. Maybe come around the other side since they're rolling.
Code 66 OR1. Code 66 OR1.
Rich, get the code card in here, please.
You got the code card? Looks like your CPR.
We've got PEA.
Oh yeah, it looks like PA. You got
Young
sinus.
trauma victim. We're on oxygen. We're on 100% oxygen. Volatiles off.
Okay, what do you
Can
want
you
me to
grab
do?
the cards and help me run the algorithm here?
Okay.
Faster and harder, please, Sandy.
Okay, so we're
I
in
want
the
you to be
PA
in charge,
algorithm.
Kyle. You're in charge of the CPR quality.
Okay, you're
And-
doing 100 times a minute, Sandy. Let me
Staying
know
alive.
when you get tired. You're
Rich,
gonna
can
take
you
over
get
when
me
you get
ready
tired.
stuff for a second IV, please?
Yeah, I'll get you.
And the pressure bag, please.
Is there a backboard on the patient yet?
It's on the back of the code card.
Okay, I need to get the backboard on.
John, until you get the backboard on, okay? And we'll
Okay.
switch it.
So we go.
Okay, let's lock that table.
Okay, get ready.
Ready?
Set her up.
Pause. All right, get
Okay,
ready
get
to
back on the
resume,
chest.
Liza.
Okay.
100 a minute, fast and hard.
So your vitals off, you said yes.
Volatile is
100%
off.
oxygen, your rate, ventilator down to
Seth,
6.
please start a second IV for me.
Okay. Sarah, rate to
I'm
6.
trying
Rate to
ventilator.
6, thank you.
Okay, let me get a tourniquet. Have you given any epinephrine yet?
We've given 1 milligram of epinephrine is in.
Sarah, what do you need?
Hey, Steve, we have a PA arrested, a young trauma victim. Can you get a TEE probe in here, please?
Alright, so we need to rule out the treatable causes for PEA. Number 1, hypovolemia. Is this patient hypovolemic?
Certainly possible in trauma. We have the IV fluids going wide open. Rich is getting a pressure bag. Rich, can you get it on this IV that's running here?
Oh, sure.
Thank you.
That's
Sesh
good.
is starting a second IV.
Perfect. Hypoxemia, 100%. What was the SATs before?
Sats were at 97. They dropped
You want
quickly.
pads on?
I'm going to listen to the long sound. Pads on, please. Thank you.
Do you want to listen? CPR. You need to
Can you
switch
go to
CPR.
manual, flip that switch for me?
I don't know how.
Yep,
this
that
one.
one.
2 minutes, you'll switch back and forth to CPR.
Pause for 1 moment. Okay.
Okay.
Resume CPR. I
Um,
hear
do you
have the ID for
clear,
me?
distant lung sounds bilaterally.
Okay.
Hold on.
Okay.
Acidosis, hyper or hypokalemia, hypoglycemia, hypocalcemia. You can check all those with the blood gas.
Excellent.
Do you have an
Steve,
A-line in?
we do not have an A-line. Once your pads are on, please get a blood gas
You have
before
an
you do the
ID here?
TE.
I'll be right with you.
It's in the second drawer, I believe.
Hypothermia or hyperthermia, any risk for any?
Temperature is
Ready?
36.4, no family history we knew of.
Okay, what
I would
are
say
the
low
signs?
risk.
Okay. Tablets, overdose,
Volatile is off.
no
Does anyone,
infusions running.
Liza, do you know of any drug history for this gentleman? There was no infusions.
I don't know
were
of
given.
any history. We
Okay.
can call the trauma intern and see if they've talked to the family.
Okay,
Do that in a minute.
so no drugs I've given, volatiles are off.
Okay, tamponade, cardiac tamponade is a trauma patient.
Certainly possible. We're gonna do an echo in just a moment.
Okay,
Steve's
who's
getting a
doing that?
blood gas before he
Okay.
does the echo.
Sounds like a good
We have
idea.
the machine here already.
Tension pneumothorax,
Possible, I listened just now and had good breath
Yeah,
sounds.
sure.
PKR
Always
pressure,
Wait till
well
session's
high
over,
with
I said.
CPR.
Yeah.
Yeah.
Nice, Dan.
Well, let's
Go
take
ahead.
this pip off.
I'll have to send it out.
Send it out, okay.
Okay, on the count of
All right,
Coronary
where are we up
thrombosis.
to?
1, 2,
Coronary
It's
thrombosis,
priming through.
pulmonary thrombosis, any PE, you said
So
a reaming?
this happened in the middle of reaming, so Liza and I were saying we
Yeah.
thought
ID
it
in,
might
you
be
can
a
go
fat
and open it.
embolism, could be a PE, but I
So
think fat
Rich,
embolism's
I
more
need this
likely.
red blood gas.
Top of our
Oh,
list.
Lights.
I'll take that.
We can see what the echo looks like, we'll know if
Hold
the
on,
RD's
just
failing,
one
as soon
second.
as he gets that in. So
Sarah,
let me-
Okay, everyone, we're running the PEA algorithm. Any input, please talk one at a time and give any suggestions.
So
Sesh?
I'm free, what can I do to help?
Excellent. Can you help Steve getting the TE probe in?
Okay.
We can consider an A-line too.
switch my hands here.
Excellent. Rich, would you get equipment ready for an A-line, please?
Okay, I'll call the anesthesia
Has it
tech.
been more than 3
Here's-
minutes, we need
you
to
can
repeat
open
the
up
epi
and
or
prep
give
everything.
vasopressin?
Okay, so we need epinephrine.
What would you like?
If
Want
you
me to
could
give-
prep the epi, that would be great.
Yeah, I'll get the epi.
Okay, Liza.
So at this point,
Okay, switch.
1, 2, 3, switch.
Sandy, can I suggest you come over to the other
Yeah,
side
you
so you
want-
guys
maybe
can
if you
switch
get
more
it from the work
smoothly?
room.
Yeah, they're
So he's
coming
pretty
with the
hyperdynamic.
Okay, well, no, we're gonna have
Okay,
an
excellent. I will give
Did
that.
you- He looks empty.
Sarah, do you hear that? It looks
Yes.
empty.
There's
So-
there's
You know
no
what?
pericardial fluid.
Okay, so we have a situation where we're either hypovolemic or relatively hypovolemic.
His RV looks, there's no volume, he's hypovolemic.
Okay, so that would go
Did
with
he have
either
a-
bleeding from somewhere
Did
or,
he have a fast exam?
I heard negative fast, though of course that's not
Can't get in there,
100%.
So I'm gonna stay on this side.
Okay, Sesh, will you listen to breath sounds again, please?
Yeah, once
We
again.
still could have a tension
Most
pneumothorax.
likely causes, if he's not tamponade, could be tension pneumo.
Do you see any fluid, Steve, around the heart?
There's no fluid around.
Okay.
So we don't, so it's either hypovolemia, tension pneumo, we don't think it's the
I heard
abnormal
decreased breath
lab.
sounds on the left.
On the left,
You do.
okay.
So pneumo.
Let's
Approximately.
get, Rich, call for a stat chest x-ray and we're gonna get a needle.
You have a 14
Liza, can
gauge?
you do can you do,
Switch, Liza?
Yep, I can do a needle
can you
decompression
do
if you
a
need me to.
chest tube?
I can do a chest tube as well.
I
Okay.
can do the needle
Count
decompression
Here's
if you
the
want.
needle.
Okay.
Second intercostal space on the left. You wanna go around?
CPR, you're doing fine with CPR, guys?
Doing good.
Great.
100
Do
per
that.
minute, so fast and deep.
Alright, we're doing it.
Okay.
Okay.
Needle
Doing the needle.
decompression.
During the needle decompression, we're gonna stop and check the pulse on 3. 1, 2, 3.
Did you get a whoosh?
Yes, I heard a little whoosh.
There's no pulse.